Hi Manhattan Beach, this is Dr. Robert Bates, and this week's topic is on nutrition and weight loss. In fact, it's a very confusing topic. What I found is because there's all different types of thoughts on high protein diets, low protein diets, low carbohydrate diets, high carbohydrate diets. So it's so confusing is that and it reflects really on how confusing our population is when it comes to nutrition and weight loss, is that you can look at it reflects in our own health. The World Health Organization ranks the United States 37th in overall health. So we're 5% of the world's population, and we take about 60% of the world's prescription drugs, which shows that if the drugs were actually working to keep us healthy, we should be a little higher than 37th in the world in overall health care. So the top three killers basically is heart disease, cancer, stroke, diabetes. So when you look at it that way, 90% of all Americans, if you practice the normal way of eating in the United States, that you're going to die, 90% of die of the top three killers of heart disease, cancer, and in there within diabetes and stroke. So you can just count on that. In fact, what concerns me though is the fact that we tend to think more of it as drug therapy for health. You look at seniors, for example. 46% of all seniors are on either 4 to 9 prescription drugs. So 4 to 9 prescription drugs. That's every day. So then you look at the amount of seniors that are on absolutely no prescription drugs is almost zero. So you look at other cultures that have the highest life expectancies, like Okinawa in Japan. You know, their seniors are taking almost zero drugs, and they have the longest life expectancy. So something's very wrong. But then you look at it, it's trickling down to our youth too, because the youth, the experts say that our current generation that's coming up, they're going to have a shorter life expectancy than our current generation here, and it's going to be the first time in American history that they're predicting that. So that's incredible, because you look at kids, 30% of kids are overweight, 19% of kids are obese. You look at cancer rates in children, are 1 out of 340 approximately are going to get cancer sometime when they're a child. So that stuff is just not working very well as far as keeping the United States healthy. So part of it, that's one of the reasons why I want to clear the information, as far as clear the information on healthcare, and we want to have this information on weight loss and nutrition. And that's coming up April 20th, Tuesday, and we're going to go over the latest information. Some of the topics that we're going to cover is, for example, how you can cut cancer rates 40%, how you can actually certain foods that protect you from cancer, heart disease, diabetes, and strokes. So, and then also weight loss. We want to be able to give you some strategies and so forth. And actually, when you practice the way that we're talking to you about eating, is that you can actually have natural weight loss, to where during the first month you're going to lose on an average of 16 pounds without even feeling hungry or that starving feeling. So we have much more that we want to cover, but it's very important that we get this information out to you. We only give this information updated once or twice a year. So this is the latest update. So this is for you, the patients, but then also just not for you. We expect you to spread the word, because it's just not about you, it's about all the society here, and they need to know also, because if you don't tell them, who else is going to tell them? No one. So we want you to spread the word to them also, so you can have them come to our special workshop on nutrition and weight loss coming up Tuesday, April 20th. And you can talk to Gio or Michelle at the front desk. Call us at 310-545-4188. And we'll look forward to seeing you. Make sure you call up early, because it's limited seating. As soon as we get to that point, we have to cut it off because we have limited seating. Okay? So have a great week. We'll talk to you next week.